Hello, everyone, and welcome to the California Telehealth Policy Coalition webinar, Leaving No One Behind, Assessing the State of Access to Virtual Care for California's Older Adult Population. My name is Amy Durbin. I'm a policy advisor for the Center for Connected Health Policy, or CCHP. Today's webinar is put on by the California Telehealth Policy Coalition, which is convened by CCHP. The coalition was initially formed in 2011 and is now made up of over 165 state and national groups interested in advancing telehealth policy in the state. We want to begin by thanking the sponsors of today's webinar, the California Healthcare Foundation, the Center for Connected Health Policy, and AARP California. Briefly, just want to go over the purpose of today's webinar, which will cover the unique opportunities and challenges to accessing care through telehealth that are currently facing the state's aging population. An overview of policy developments at the federal and state level will be provided as stakeholders discuss impacts and next steps. Here's our agenda for the day. After this welcome, we will get straight into a panelist discussion, including a policy overview with Dr. Zia Agha, Chief Medical Officer and Executive Vice President at West Health, as our moderator, and speakers including Brian Carter at the Department of Aging, Joe Garbanzos at AARP California, and David Lindeman at Citrus Health. In addition, just a reminder that attendees will be muted during the webinar, and then any questions for our speakers should be put in the Q&A box, not the chat function, which will be reserved for any technical issues. I'll now hand it over to Dr. Agha for his opening remarks and introduction, leading us into the overview and discussion.
Amy, thank you so much for hosting this webinar, for including us. I thank you on behalf of all of the panelists. We're excited that we are touching on a topic that's near and dear to all of us, which is the older population in California, and how do we help enable them to start to participate in this amazing work and opportunity around the digital delivery of healthcare and telehealth. As we think about this population, it's the fastest growing demographic in our state and in the nation. We have also seen through the lens of the pandemic that this population is able to engage using technology with healthcare providers. We saw a huge uptick in telehealth visits. Some of it was facilitated by important policy changes, and we will cover that today. Some of it was facilitated by providers developing programs, and we will learn about that from our panelists about what programs were created and how do we support them. And then there's a need for also providing access. And so we will hear about how can we provide better access, whether it's through broadband technologies or handing out devices, providing training. So all of those important issues we hope to cover. I think what's in the background, the tailwinds really behind this work in California is, of course, what's happened with the pandemic and the change that's that has sort of evolved from there. I think we also have some really important sort of mega movements happening with our state. The Master Plan for Aging is one of those. It's a 10-year ambitious roadmap to help deliver high-quality healthcare and supportive services to all Californians. Doesn't matter where you live. And that's what we're going to talk about today. How do we leave no one behind when it comes to digital care and virtual care? With that, I would love to introduce our panelists and then talk a little bit about West Health and what we are doing in this space. So our panel today, glad that Brian Carter is going to be representing the California Department of Aging and talk about the important work he is doing on the digital divide, along with the Master Plan for Aging. Amy, you're a policy advisor at the Center for Connected Health Policy, will really give us a bird's eye view of where are we today on federal and state policy and how is that helping us and what needs to happen to continue to keep those policies in place as we move forward. Joe is the state president for AARP California, an organization that none of you need introduction to, but Joe will really talk about what are some of the bright spots, what is happening today, and how is AARP engaging, and share some really interesting data from a survey that they conducted. And then last but not least, David Lindeman, dear colleague of mine, Executive Director at Citrus Health and Banto Institute at the University of California, Berkeley. David has been engaged, obviously, with the work with the Master Plan for Aging and the digital divide there, but also some really interesting projects that he's involved with at the university, and will share some highlights from that perspective. A little bit about West Health and my organization. West Health is a nonprofit organization founded by Gary and Mary West more than 15 years ago. We operate out of San Diego, California, and have a policy center in Washington, D.C. We're one of 6 foundations and organizations that is solely focused on aging. And our goal is to enable successful aging for all seniors. As we think about telemedicine and telehealth and virtual care, of course, that is a critical ingredient of how we provide access to care, whether it is medical services or non-medical services, whether it is combating isolation, as we saw during the pandemic. And so I'm really pleased that West Health is also taking a leadership role on telehealth and has developed some resources and put together a coalition. Robbie, you want to advance to the next slide? I can touch upon this more just as an FYI. But one of the areas for improvement on telehealth is really bringing together the healthcare systems and providers, some of who may be present today, and helping align on what is good care for seniors and what does telehealth mean for seniors. And so the role of this collaborative, you can go to the next slide, is to start to develop some tools and guidelines. And we've worked with David and other experts to really develop what we call our principles for good telehealth for seniors and how that care can be delivered. The initiative is going to have a center of excellence with the University of Virginia that will both do research, provide implementation resources, and really engage with the larger community. So I'm excited to share a little bit about that. But without further ado, I would love to sort of move us into our panel discussion. We've introduced the panelists, and I'll ask Amy to please kick us off.
Absolutely. Well, thank you for that, Dr. Agha. So sure, just to kick off a brief federal and state policy overview related to Medicare and Medi-Cal, we have this first slide here showcasing the main changes to Medicare telehealth policy during COVID-19. Historically, there have been many restrictions federally related to limiting where a patient and provider can be located in order to receive telehealth services and reimbursement, as well as limits on types of modality that can be used and services provided over those modalities. So many of these restrictions were waived and services expanded, allowing patients to be in the home and the ability to utilize audio only. There were also some prescribing and privacy exceptions made. In terms of recent longer-term policy developments at the federal level, there has been additional Medicare activity largely passed as part of congressional budget bills over the past couple of years. For instance, some permanent exceptions were made specific to mental health services via telehealth that will kick in post-public health emergency, but they do include limitations and additional requirements, for instance, requiring a prior in-person visit within 6 months of the telehealth encounter. This year's budget bill included an additional extension post-public health emergency to add a transition period after the PHE expires of 151 days, where many of the telehealth flexibilities will continue. And then CMS has made some changes as well as part of its physician fee schedule updates, extending some temporary service additions until 2023, and then allowing some permanent exceptions related to audio only and FQHC, RHC providers. But again, those include limitations and are largely specific to mental health. The Office of Civil Rights also issued some guidance recently to explain how ADA laws apply to telehealth and to ensure equal access, including how providers must make reasonable modifications, including the provision of additional support for telehealth visits. And that includes communication aids and services at no additional cost. Moving on to Medi-Cal, the state recently adopted its own post-emergency policies that for the most part kick in at the beginning of next year. And those ensure continued coverage of and payment parity for all telehealth modalities and all providers, including FQHCs and RHCs. However, some new limitations and requirements will apply. For instance, patients will only be able to be established via live video, although some exceptions apply related to asynchronous telehealth by FQHC, RHC providers, as well as audio-only telehealth for sensitive services such as behavioral and reproductive health, or if the patient requests the modality or does not have access to live video. New consent requirements will also kick in after the first of the year that only apply to Medi-Cal patients. And then beginning no earlier than 2024, a couple additional requirements will apply, including a requirement that providers offering audio only also offer live video, as well as the requirement that providers offering live video and audio only also provide in-person care or facilitate access to in-person care. Lastly, the legislation also required that the department develop a research and evaluation plan to look at telehealth access within Medi-Cal, which is due prior to the 1st of next year as well. And with that, I'll turn it back to you, Dr. Agha.
Amy, thank you so much. Whenever I have a policy question, I of course reach out to my colleague May and your team. How do people on the call? I mean, this is a wealth of information, very technical, and when it comes to governance and policy, you guys are the leaders. How can folks reach out to you?
They can always email us directly. My email will pop up on one of the slides towards the end, and so folks can reach out directly that way and ask questions. They can also go to CCHP's website, cchpca.org, and find the latest updates there, also relevant to the California Telehealth Policy Coalition. We have a newsletter that folks can subscribe to where we make sure to put out all those, latest tidbits related to state and federal policy that folks can monitor. But again, we're always here as a resource for individual questions as well.
Thank you. Well, I want to bridge from the important area of policy and how policy initiatives have really helped us in advancing telehealth and will help us even further. I want to transition to Brian, who's helping lead this really important work in our state with the Department of Aging. Brian, if you want to give an introduction to your organization, a little bit about the Master Plan for Aging and how that plays into this digital divide work that you're leading.
Yes, indeed. Thank you, Dr. Agha, and good morning, everyone. I really like to thank the California Telehealth Policy Coalition for this opportunity to share some of the noteworthy efforts to bridge the digital divide taking place here at the California Department of Aging. Next slide, please. So as social isolation and loneliness were exacerbated by the COVID-19 pandemic and the resulting confinement to our homes, I'd like to begin by sharing with you some eye-opening statistics which illustrate how the digital divide, which is the divide between those with access to technology and broadband, contributes to the following issues impacting older adults. Nearly 1 in 4 adults aged 65 and over are considered socially isolated, and nearly 1 out of 3 adults over 45 feel lonely. Social isolation increases the chance of premature death and rivals the risks of smoking, obesity, and inactivity. Older adults now are living longer than 20 years ago, but are more likely to live alone and to be far less socially engaged than the previous generation. Additionally, a 2019 Pew study found that only 73% of people over 65 utilize the internet. Also, older adults in California have limited access in their own homes. Only 69% of those 65 and over have broadband access. And for those 75 years of age or older, the number declined to 58%. Now, the Center for Disease Control describes loneliness and social isolation as serious public health risks. So to set the stage with that, closing the digital divide means access to information where we no longer need, to find an encyclopedia, right? Though I would encourage everyone to consult with your local libraries who have some amazing programs underway related to digital resources. But access to technology means being able to find an apartment or senior housing, submit applications, and attend virtual telehealth visits for those who lack transportation. So everything on this slide, from transportation to healthcare to housing access, have 2 things in common: equity and access. Next slide, please. So how do we close the digital divide? Well, let's begin with connectivity, where older adults benefit from 2 types of connectivity for home and community-based services: broadband via Wi-Fi, which is internet connection provided through a router at a physical location, such as a home, a community center, or a place of business. There's also broadband via 5G, which is internet connection provided through a cell tower by a specific cellular provider that generally allows for better mobility in a community as long as the cellular provider services the associated area. The next component is access to a device. A device should be able to maintain the following features, such as general app compatibility, for example, telehealth applications or Zoom and FaceTime, so they can visit with their family and friends and community members. There's also mobility, which is easy to carry and they can move around to different areas as needed to ensure access. There's also connectivity, which is Wi-Fi capability or 5G capable, as we just stated. The third component is digital literacy. Digital literacy is a person's ability to find, evaluate, and communicate information through digital resources. Now, there's no one best path to or program to achieving a desired digital literacy level. However, program experience has confirmed without training opportunities and technical support, many older adults will simply not be able to use a device, that is even one that is provided to them, or know how to successfully connect to the internet. And as a result, the digital divide will persist. So ultimately, connectivity plus a device plus digital literacy equals the capability to digitally engage. Okay. Now, in response to Governor Gavin Newsom's Executive Order N7320, and in support of Governor Newsom's Master Plan for Aging, I'd like to highlight two excerpts from the executive order, which I feel are pertinent and relevant to our topics here today. The first excerpt reads as such: whereas telehealth greatly expands the ability of Californians to access medical, behavioral, and oral health services, and has been prioritized across health systems during the COVID-19 pandemic, yet not all Californians have access to sufficient broadband to allow live video connections, right? Also under the adoption section of the executive order number 15 reads, the California Department of Aging, in partnership with CDT and CPUC, is directed to analyze the needs of people ages 60 and older for access to affordable, reliable, high-speed broadband, and to identify programs and partnership opportunities to close the digital divide among older Californians. So as Dr. Agha mentioned earlier, referred to the mission of West Health, we share that mission here at the California Department of Aging. Additionally, 5 bold goals were identified in the Master Plan for Aging, and I encourage all of you, when you have an opportunity, to visit the Master Plan for Aging webpage on the CDA's website at mpa.aging.ca.gov, also shown here at the bottom of our slide. Now, one of those 5 bold goals is goal number 3, which is inclusion and equity, not isolation. This is the goal under which CDA's efforts to bridge the digital divide are housed. Goal number 3 states, we will have lifelong opportunities for work, volunteering, engagement, and leadership, and will be protected from isolation, discrimination, abuse, neglect, and exploitation. And as we are all aware, digital technologies are fostering new opportunities for connection and inclusion for work, play, community, culture, and commerce. However, over 2 million Californians do not have access to high-speed internet, and approximately 34% of adults over 60 do not use the internet at all. But this is something that many of us may take for granted due to our digital access. But as we become increasingly necessary for us to use digital devices each and every day, it just becomes more glaring. So the COVID-19 pandemic additionally has brought these issues into greater focus. and heighten the need for improved access to broadband, digital devices, and technology support for older adults and persons with disabilities. And before I leave this slide, I'll also say within each bold goal in the Master Plan for Aging are a number of strategies, and strategy B of bold goal number 3 is closing the digital divide. Closing the digital divide by increasing access to the internet and providing digital devices will improve the ability of older adults and persons with disabilities to connect to family and friends, healthcare providers, and to access additional support during the COVID-19 pandemic and beyond. Embedded within Strategy B, closing the digital divide, are the following initiatives. Initiative 81, which is to execute the State Broadband Council's new strategic plan, including older adults and using an equity lens within existing resources. Now, we truly at CDA truly enjoy our partnership we've developed with the California Department of Technology, and we look forward to playing our role as it pertains to the strategic plan. There's also Initiative 82, which is to seek private donations and use existing funds to distribute personal technology devices to older Americans or Older Americans Act program participants. And as you'll soon learn, CDA has expanded its digital divide efforts beyond Older Americans Act programs to include additional programs and resources serving older adults and persons with disabilities across the state. Then lastly, there's Initiative 83, which is to develop a plan to launch digital literacy support for older adults and for providers. This plan has come to fruition as all of CDA's digital divide programs have digital literacy as a fundamental component. All right, next slide, please. So now that we've discussed, now that we've discussed Executive Order N7320 and the Master Plan for Aging as it relates to closing the digital divide, I'd like to share with you some of the noteworthy efforts to bridge the digital divide, again, taking place here at CDA. So CDA's initial effort to bridge the digital divide and address social isolation for older Californians and persons with disabilities was our Google Home Smart Speakers project. In January of 2021, CDA partnered with Google and received a donation of 8,500 Google Home smart speakers that were distributed to participants in the Older Americans Act programs and the Multipurpose Senior Services Program, MSSP, across the state. Our next effort to bridge the digital divide is our Connections, Health, Aging, and Technology, acronym CHAT program. Through this effort, CDA has partnered with the area agencies on aging to distribute at least 4,000 iPads with data plans, customized onboarding, technical support, and digital literacy training to older Californians. The purpose of this project is to mitigate loneliness and isolation for older adults, providing them with greater access to resources and information. Now, for this project, CDA has partnered with the University of Southern California's Graduate School of Gerontology to develop tools that will evaluate the effectiveness of digital devices in reducing social isolation for device recipients. And if you know someone who would like to apply for participation in our chat program and receive a free iPad, please encourage them to contact their local area agency on aging. CDA is also in the process of implementing a $50 million Access to Technology, acronym ATT, not AT&T, just ATT, county grant program for older adults and persons with disabilities. Now, with this initiative, we are partnering with the California Welfare Directors Association and a work group of County Human Services Department directors. With the AT&T program, I just said, with the ATT program, counties will be able to leverage their existing programs and program recipients to provide digital devices, broadband service plans, digital literacy training, digital infrastructure to facilitate access and outreach to bring awareness to the program. Now, this program is intended also to reduce isolation, increase connections, and enhance self-confidence for program participants. Now, we also are concurrently preparing to launch CDA's Digital Connections program, which is a $17 million program to expand on our current chat program to also include CDA's MSSP and Community-Based Adult Services, our CBAS program recipients. This program will include purchase of digital, and also Department of Healthcare Services PACE program unit. Now, this program will include purchase of digital devices and digital education and literacy. And goals of this program are to allow participants to remain in digital contact with healthcare providers, family, friends, caregivers, and other service providers and or case managers, as well as access to telehealth. And I must, and next slide, please. Now, I will close by saying CDA will continue seeking opportunities to partner with government agencies such as the Department of Technology, the California State Libraries, and others, as well as foundations and nonprofit organizations to expand access to technology and services to California's older adults and to help California close the digital divide. Now, to learn more about CDA's programs, services, and the Master Plan for Aging, please go to the CDA website at aging.ca.gov. And if you know someone who could benefit from a digital device, please ask them to contact their local area agency on aging. Now I'll turn it back over to Dr. Agha.
Brian, thank you for the, first of all, the impressive work that the CDA and your team is doing for all Californians. Really appreciate that. I definitely see that there is a theme here or a linkage. You know, we talked about the policy framework, and there's a big emphasis on behavioral health there. As we look at the programs that you are doing, again, an emphasis on isolation, behavioral health challenges, and that's of course important given what we've suffered through during the pandemic.
Certainly.
And so we've talked about policy, we've talked about the role of the state, and especially on access through providing tools and technologies and partnerships with community organizations. And one of our most important and sort of well-known community organization, I guess, is AARP. And I'd love to have Joe tell us about some of the bright spots that he and his organization have sort of documented in the last few years during the pandemic, some data from a freshly done survey on how do we really help change the conversation around seniors and older adults and telehealth. There is an element of ageism that older folks cannot participate in this technology. And I think Joe will help dispel that today.
Thank you. Thank you for the kind introduction, Brian. Good job. A shout out to Brian's agency, which is lead agency in terms of monitoring and tracking progress, the implementation, the Master Plan for Aging. They just launched a dashboard that has information about progress related to the goals and objectives that Brian touched on. I would advise, request, and encourage people to check on that dashboard, because at the end of the day, it's what the results, the outcomes are what matters, right? So I think that dashboard is up, and it's a good source of information to see progress in terms of implementation. But thank you for having me. So I represent AARP as state president, as a volunteer position. AARP, nonprofit, non-partisan organization, representing about 3.7, 3.8 million perhaps of our members in California. And we represent them as well as the livable communities that they live in. So I will be remiss if I don't give a shout out to our Latino, Hispanic, and Filipino communities who are celebrating their Heritage Month. These groups have contributed to our society significantly. I'd like to honor and recognize their contribution. I'm here in Oakland today, and I was telling the panel before we went live that at breakfast this morning, facing 11th Street, right here in Oakland, I saw a bus with a huge sign, "See your doctor without driving." See your doctor without driving, which reminds me that when a thing is captured on a bumper sticker, you know it has sticking power, right? So that's telehealth. ARP, just to put some context around the slide that I think Robbie is going to be sharing or has shared, ARP has conducted 2 short surveys in the very early days of the pandemic to capture midlife and older adults' knowledge and use of telehealth services. The results are 1 in 5, about 21% of respondents said that they have used telehealth services the previous month. That was March 2020. Then recently, as ARP is interested in learning more, recently, February, March 2022 timeframe, we fielded another survey with modified questions to align with the timing and the duration of the pandemic. And the survey found that 51% of adults aged 50 and their family members have used telehealth in the previous 2 years. So it has increased. Additional data on results are reflected on the slide, and the link to see more about the survey methodology and criteria in terms of selecting respondents are available on the chat. So Robbie, if you can post that for those people who want to dive deeper into the survey methods and results, that's available to you. You know, telehealth is not going away. That's the main takeaway from the survey. The question is how telehealth can be integrated into standards of care to produce desirable outcomes, right? So, you know, Medicare is as close as any when it comes to universal care for 65 years and older and people with disabilities here in the US. It is a good program, but it was created 50 years ago, right? So many of the rules and provisions are, you may argue, outdated. But there's optimism with waiver programs and innovations coming from organizations like West Health and others. We are seeing more innovation, and this can be done for telehealth as well. I'm referring to, you know, reimbursement, value reimbursement versus say per member per month kind of a model, paying for wellness and prevention, investment in technology, investment in training of not only beneficiaries, patients, but providers and their staff. I used to be part of the federally qualified health clinic world. So it is a safety net that is responsible for ambitious mission, but with very low investment. So that's an area I think where more can be done. But here's a big one. The question about affordable and reliable high-speed connectivity, which Brian touched on, broadband, is an important question. For us, the full promise of telehealth, which is access and outcomes, cannot be realized, especially in areas with high social disparities, without affordable and reliable access to high-speed internet connectivity to the aging population, tribal and rural communities. So I know our panel will focus here in the California dynamics, but ARP is working as an aside with the UN Secretary General as part of the UN Digital Compact, which aims to connect every person in the world to the internet by 2030. It starts here, obviously at home, here in California. And I think this panel conversation is surely a big step in terms of providing ideas and solutions that will provide access to not only our senior population, but people with disabilities in rural communities, as well as communities with social disparities. More information about the aging population and the digital divide is available as a fact sheet on the chat, which Robbie is going to post. So back to you, Dr. Agha.
Thank you so much, Joe. Really wonderful perspective that you have brought together, both in terms of the utilization and then also the barriers to access. And the important work that AARP is doing in this space as an advocacy organization and a leader in healthcare. Talking about leaders in healthcare, I would love to close this panel with David to really talk about, how some of the really interesting new applications of telehealth, like robotics and home monitoring, and how can those be made accessible and available to seniors. And David has some really interesting projects that he's been involved with that sort of brings us full circle with sort of the policy landscape, gaps in coverage and technology, how do we engage with our older population with AARP's work, and then the work that David is leading. So David, please close us out.
Well, thank you, Zia, for that very kind introduction, and delighted to join my fellow panelists and round out a few of the points that we heard from Amy on policy, Brian with the fantastic work that's going on. We've seen just huge growth with the department. And again, Joe is sharing how AARP is reaching so many individuals. I'd just like to first start by reinforcing the importance we're seeing in this space. I know this group that's attending today, the coalition, really, you folks know this space very well. What I'm not sure everybody appreciates is just how much this has changed in the aging space, how we're using telehealth, how we're using connectivity and expansion and broadband in this space. So I'll just mention a few of those points, share with you a bit about what we have done at Citrus, and again, share one project that I think is important that adds to what we've heard already today. Very quickly, for those who don't know Citrus, we are a 4-campus, multi-interdisciplinary program in the University of California system. Been operational for 20 years. Citrus Health is a subsection of that, and we focus on a number of digital health areas. Key area has been healthy aging and digital world, particularly with our colleagues at Davis and Berkeley. And again, now different telehealth programs, particularly that were created during COVID. And what we add often now is the excellence that we have in California in terms of our machine intelligence work, being able to add data analytics to this area. Very important area. Next slide, please. But I want to reinforce that as we're looking at telehealth, there are so many new technologies that have been in the aging space that are dependent on connectivity, internet, et cetera. And we're seeing massive changes in this area, not just the growth of telehealth itself, but the way we need connectivity for many different areas, and the way we're seeing new improvements in telehealth, whether it's through VR and AR, whether it's through bringing new types of integration of new services and care management, changing a great deal in just the last few years. Next slide, please. But particularly during COVID, we saw some tremendous changes. We all know about telehealth. In the UC system, we had a 5,000% increase across the 5 UC medical centers in telehealth. It's fallen back. We've seen telehealth, this group knows it and has been getting, the monthly meetings are fantastic on updates in that area. But it's important to realize that for older adults, there were several other major changes. And that is that we're seeing much more with remote technologies, wearables in particular being, since we were isolated, could not reach individuals either in their homes or in residential settings. Also, we've really seen that come on to the fore, smart homes, and that technology has really blossomed during this period. And we're going to see much more of that with embedded sensors going forward. Virtual reality has not only been used in terms of how to support older adults, but also how to train individuals. Embodied Labs is a perfect company that is really expanded this in this area, but needs to have internet connectivity and telehealth to work. And finally, robotics, where it's not just seeing robots to help bring services to individuals, but the machine intelligence that goes behind it has really, again, come to the fore. Next slide. So during the pandemic, one of the projects we stood up at Citrus has been the Lighthouse program. I know some people here understand that. What we looked at is what was the pain point for groups that were isolated in this situation. We went to the issue of affordable housing and worked with our colleagues at Front Porch and Eschaton, two of the premier senior living communities in the state, to roll out a program to 6 of their buildings to see what it would take to do the issues around bringing connectivity into them, getting them devices, training and supporting, and then being able to use it in a number of ways. A few of the key outcomes that were critical were that just getting broadband into many residential programs is a fundamental challenge. It took a year and a half for several of the buildings to even be able to get broadband in, much less than having the right type of connectivity. Second is plans. In low-cost programs, we see again and again that people cannot afford to have the internet, pay for the internet to handle this area. And then devices themselves changing so quickly. It's wonderful to see what CDA is going to be bringing to so many people, but this rapidity of how fast devices and software change for different form factors is incredible. And how to support people. We created a peer training program with people in those buildings to help each other. And so they could address this issue, not only immediately during isolation, but as a support system going forward. We've now created a playbook out of this, and we're going to be working with Leading Age California to reach all 800 affordable housing programs in the state as a way to help address this issue now and going forward away from the pandemic. Next slide, please. Just want to leave you with 2 key points, if I could. One, as you've heard from Joe, Brian, all of us have said, this is a very at-risk population, second largest demographic group who do not have the internet. And just want to point out one more time that during the pandemic, 40% of those individuals who were affected did not have access to technology at all. So that's a critical factor. How do we reach this very at-risk group? Next slide. And the final point I'd like to make is, again, the access neediness, as you heard from Joe and Brian again, it's not just for the well-being of individuals, but it's to be equitable. And that's what I love about our master plan on aging and where the Department on Aging is going. We are looking at bringing equity across the state. So with that, I'll wrap up so we can carry on a discussion. But I do want to thank the coalition for inviting us all to speak on this issue. We hope it stays front and center for years to come. Thank you.
Thank you, David, for your presentation and really to highlight some of the key opportunities, but also challenges moving forward. As we move into sort of our next phase of the discussion, there's tremendous momentum that we should capitalize on sort of telehealth in terms of both what happened due to the pandemic, some of the policy issues. There's tremendous momentum due to the technological innovations, the work that the state is leading. But I worry that will we lose this momentum? So please tell the audience, and let's discuss, all 4 of us on the panel, what will it take to help us keep this momentum going, to close the digital divide, and to make it equitable and accessible for all Californians.
Well,
and Amy, if you want to lead us off, or David, this is open now to all of us.
Please, Amy.
Yeah, thank you. Thank you. Yeah, I mean, I think it involves acknowledging how intertwined telehealth is to broadband access for telehealth organizations, the need for accessing digital devices and offering digital literacy support, and then advocacy consistent with that understanding, so policymakers accommodate that relationship within their policies, for instance, policies that ensure access to audio only and provider patient education and resources, as ongoing broadband work continues. And it also involves identifying areas of collaboration. I know, currently the coalition is trying to identify and work with other organizations that are specifically focused in the broadband space, so we can ensure together that the health voice and telehealth voice is involved and heard within the larger digital divide conversation, which I know sometimes policymakers, have focused on other communities and industries in that discussion. And so I think it's important that we continue to highlight and bring in that health and telehealth perspective.
Thank you, Amy. I'm just going to go down the screen as I'm seeing people on my screen. So David, do you want to go next?
I'll add to Amy's point. I think that critical to going forward, in addition to the policy efforts that we're seeing now, really the attention that we're seeing at not only a state but national, federal level, and budget, where we're finally seeing serious resources, are the issues that we mentioned on different areas. And that is, it's not just getting devices, not just getting the connectivity, as important as those two are, but it's going to be the digital literacy issue. The fact that we have some major challenges to, even though we're seeing older adults become more digital savvy in coming in, but there's still huge gaps. And in addition, we have some fundamental issues like we discovered in Lighthouse. When we went into buildings, the key fundamental challenge we found is that in some buildings we had over 10 languages that we had to address. If we don't have training and we don't have support for individuals, much less their comfort level in a culturally relevant way, we're going to have serious challenges to reach individuals to take full advantage of this area.
David, would you, on the digital literacy part, is there also some responsibility on the part of the technology designers to really develop these tools, taking into account older adults?
Yes, the basic ways that we're dealing with different form factors, different ways to connect. I think the Google and Amazons, where we're getting not only voice interaction but translation services, that will be fundamental. But we still have that key issue that I think this group particularly is sensitive to, that we need to do it where technologists and companies, excuse me, and government make sure they do involve the older adult and the workforce at the same time. The idea of co-creation so that these are done properly and we can really reduce those barriers. And I do want to just say one point before wrapping on that part, and that is the workforce. What we've talked about today are really reaching older adults directly and through some service providers, but the workforce is equally important in terms of digital literacy. Some of them are digital natives and being able to do that, but also the fact that we do not have, particularly in aging, not only enough geriatricians, nurse practitioners, therapists, but we don't have enough, clearly, personal care aides, frontline workers. And without telehealth and using technology, we are not going to be able to keep up with the individuals who do need support in this population.
David, thank you for bringing those two thoughts together. Brian, do you want to comment? And I know that the Master Plan for Aging, one of the board goals is supporting workforce, but how do you think the state can play an effective role in closing the digital divide and making it equitable?
Well, Zia, they say it takes a village to raise a child. In my opinion, it takes a village to bridge the digital divide. We have organizations like the Middle Mile Advisory Committee, who's working on, building the infrastructure to bring equitable, high-speed broadband services to all Californians. And because there are areas of the state where even those who have the means to pay for internet service, it's just not possible. It's not available. So that's one of the key efforts, as Joe pointed out. We need the infrastructure to provide broadband services, one of the core elements. The FCC is working on the Affordable Connectivity Program, which is a huge endeavor to try to make internet and broadband services affordable to everyone, which is, tremendous in my opinion. We also have organizations like CDA, Citrus, ITUP, AARP, who are all working together to try to bridge the digital divide. So I guess what I'm saying is this is a faceted issue that needs to be addressed as a group effort.
Thank you so much. Joe, we're going to have you close us with the response to the question from your perspective. What will it take to really help keep this momentum going?
No pressure, Dr. Agha. You are setting me up to do an ambitious job here. It's wrapping up a very thoughtful and I think instructive discussion this afternoon. But for AARP, and this is part of the UN initiative I was referring to you earlier, we offer with others a roadmap in terms of narrowing, if not eliminating, the digital divide. Number one, making broadband infrastructure accessible to the aging population. David touched on this. There are 22 million older adults in the US that lack high-speed internet connectivity. Medicaid population 3 times more likely to be offline. Sorry about the noise in the background. So that's number one. Number two is being inclusive in the digital design. And again, David touched on this, that the needs of older adults and people with disabilities is not an afterthought, that it should be part of the planning process, right? It should not be an afterthought or nice to do. It should be part of the design. Number three, addressing digital skills and the gap that exists. That means addressing new and emerging technologies. David mentioned it's very rapid. So I think replicating real life needs of older adults, caregivers, healthcare providers, and social services organizations, key to narrowing the digital divide. And lastly, number four, culture in language. And a wise fellow once said, culture eats strategy for breakfast. Culture eats strategy for breakfast. So nothing will succeed without meeting people at their own terms in their communities. So I think that's the insight, perhaps, when it comes to kind of mega projects and major initiatives. We need to be mindful of culture in the implementation. So more on this roadmap on expanding digital inclusion for aging population, available on the fact sheet that Robbie can put up on the chat. Thank you.
Thank you so much, Joe. We have a few more minutes left. There are questions that folks have submitted on their chat, and I'm going to go sort of in the questions sort of the way they're showing up in front of me. So please, sorry if I miss your question. We try to address all of them. So brief, quick answers from one of the panelists would be very helpful. The first question is, should we be worried about what I would say the unintended negative consequences of using technology for this population? And how do we mitigate that? How do we bake that into our design and delivery process? So David or Joe, anybody wants to take that?
Well, I'll jump in first. I think Joe really covered it with the areas that we need to be responsive to as we plan on this. But if we just use one of the key examples from the Master Plan on Aging and where the state's going and our Commission on Aging, looking at behavioral health, these are the types of issues that we need to anticipate. What are the unintended consequences through social isolation? Well, we have to anticipate even deeper issues that you can't always catch everything in a telehealth format, and we need to be able to look at it holistically with the healthcare providers. So again, I think we have several opportunities going forward where we can take the advantages of telehealth, of connectivity, but we have to make sure that we don't forget some of these side issues that we can get from in-person, hands-on, low-touch approaches to working with older adults.
Thank you, David. Anybody else wants to chime in on this one?
Yeah, I would just echo what David pointed out as far as the kind of unintended consequence. And I frame it in terms of utilization, right? I know we have managed care friends who are participating in this panel, but managed care is, effective utilization. And telehealth should not be an either or kind of a proposition, right? It should be synergistic to what David was talking about. So by overutilizing telehealth and underutilizing other platforms to deliver good outcomes, I think is a lousy exchange.
So on that note, the next question actually bridges really nicely. The question is, as we think about payment models, what is the opportunity to incentivize both sort of telehealth uptake by the workforce or providers, but also is there a focus on payment for digital literacy education? And how do we ensure that? And so maybe Amy, do you want to take that one?
Yeah, I mean, I think alternative payment models are a big focus in the value-based care conversation, and how do we, as we touched on, manage care and trying to build in those educational resources. I mean, I think that's a lot of where digital literacy kind of lies, is making sure we're educating both patients and providers. And unfortunately, when it comes to, way healthcare works and incentivizing that through ensuring that there's coverage and reimbursement, and oftentimes it's finding those different ways through alternative payment models. And I know that's something the state has been very focused on, especially in Medi-Cal and for specific providers such as FQHC and RHC providers. So I think there's definitely more to come on that point.
Yeah, Brian, do you want to talk about some of the state models like Amy alluded to, like PACE or FQHCs that really incentivize the right type of connections and coordination of care?
Sure. Well, here at CDA, we do work closely with our partners, the area agencies on aging, who administer this programs, at the ground level, and through their vendors and subcontractors, and really try to stay abreast of those concerns in that way. But I will say that with CDA, we've built in digital literacy education into our programs as we design, plan, and eventually implement them. So we want to make sure that aspect is captured because it's truly important part of the picture.
Thank you so much. We're almost to the top of the hour. I do want to first thank all of the esteemed panelists for participating in today's panel and really sharing a wealth of knowledge, and then also providing some really interesting tools and links for people to follow on. We would love to continue this conversation, obviously, but we have only 2 minutes left. And I do believe that that Amy has some follow-up information for all of you on next webinars that are coming up. But please feel free to reach out to all of us. Our emails and information will be provided to you, and we can continue the conversation offline. Thank you so much. Amy, over to you.
Thank you, Dr. Agha. Yeah, Robbie, if you want to share our closing slides. I think first, David had provided us this slide. So just a virtual innovation summit coming up, launching on October 13th. So wanted to alert folks to that. And then, again, just thank you, Dr. Agha, for moderating today, to our wonderful panelists for participating. We also want to thank today's sponsors once again, AARP California, the California Healthcare Foundation, the Center for Connected Health Policy. And then again, feel free to reach out to staff with any questions, anything that we weren't able to get to today, or any resources. That's what we're here for. So just a few closing announcements regarding upcoming coalition meetings and events. Our education committee will be meeting next week. We'll also have our annual legislative briefing on October 13th, and then the coalition's monthly meetings October 21st. And our annual meeting will be on November 10th. It will be hybrid this year, so in person at the California Endowment in Sacramento for those that can make it, as well as virtual. So please make sure to register. And with that, we will close today's webinar. Thank you so much to everyone for attending, and have a great rest of your day.